So PCOS is the hormonal imbalance where a lot of the ovaries, that's what we commonly call the eggs, they often make higher levels or higher than normal levels of androgens. Androgens are usually assigned to men. It doesn't mean that women don't have androgens. Women do, but their eggs may end up producing a lot of these hormones, which is called the androgen, and then it tips them to masculinity, or it tips them to have a lot of symptoms related to men. The imbalance may also, that is, the imbalance in the hormones may evolve and then cause normal ovulation to become what abnormal. So a woman who has PCOS may not be ovulating adequately as they are supposed to. In the same way, many of the people who have PCOS, they may go to the hospital and not even have any symptom of cyst in their ovaries, but otherwise they may still be having the PCOS. What are some of the common symptoms that one may show that will tell that this person actually has PCOS? There is number one, that is the irregular or infrequent, very long or missed periods. When I say very long, it doesn't mean that you have a period and then it stops. No, your periods between the one you've had already and the one that is to come may be a very, very long duration. Now, there is also sign of excess androgen. Excess androgen is this: the hair I have on my face. There is increased facial or body hair, and that is where we call hirsutism. Hirsutism is abnormal distribution of the hair on different parts of the woman's body, which we know that is not supposed to be so. There is also weight gain. The woman and they get to the stage where they increase in weight abnormally because they don't know what they are actually doing to cause them to be increasing in weight. It may be as a result of the hormones, which is not from your food, it's not from any activity you are doing that is causing the hormones to just they just keep increasing. It may not be any of that, but the hormones are causing that. There's also difficulty in getting pregnant. In this point, a lot of people become frustrated, and that is where they get to be diagnosed the first time. Sometimes people have this, what we call velvet skin patches. They get these patches, especially you won't see it a lot in black people. You will see it if the person is white. I mean, the Europeans, the Americans, Indians, Pakistanis, or the Asians, you see them. But if you are from Africa, usually the velvet pink skin coloration, you wouldn't really see them. So what or why does it matter in the long term? That this is where the problem lies. So when we talk about PCOS, it increases the risk of insulin resistance. Please let me take that again. It increases the resistance of insulin, which means that you become automatically diabetic. Now, it's not because you are diabetic, but the presence of, or let me say, it puts you into pre-diabetic phase. That is the type 2 diabetes. At this point, you eat, the glucose remains in your body, which then contributes to why you are even gaining excessive weight. You don't know what to do and stuff like that. It is also linked to higher chances of high blood pressure, abnormal cholesterol accumulation, and heart disease over the period of time. There is also untreated long-term irregular periods, which we've talked about, the fertility issues, the dysmenorrhea or amenorrhea, the painful menstruation sometimes when you are even fortunate to get the menses. So all these are there, but to diagnose it, because we'll be going a little bit deeper into it. Okay, so let me just walk you through some of them. Now, to diagnose it, you need to go see your doctors, and then your doctors are going to call in for an ultrasound, an abdominal pelvic ultrasound scan. When this is done, they are going to see multiple cysts. I mentioned that earlier. They are going to see multiple cysts in the egg or the ovaries, and these cysts, usually we peg it around 12 to 13 cysts in the egg. That is why we call it polycystic. Okay, so we see these multiple cysts, and then they tend to be present in the ovaries. All right, and that is one. Now the other ones happen to be the symptoms, like the diabetes. We may be able to pick the insulin sensitivity, insensitivity, or resistance in one of those. We can also other things that may mimic the PCOS. You may see things like high levels of prolactin, okay, especially women who at the point where they want to get pregnant and stuff like that, it becomes a problem. There is hirsutism, I've mentioned. There is obesity, that is increase in body weight. The ovaries becomes irregular. You are unable to menstruate and stuff like that. In order to treat this, please go and see your doctor, see your gynecologist, because this is an educational platform. But otherwise, if there are any questions, you can still drop them in the comment section. There is more to come on PCOS. We are going to bring you researches and other things that have been done, what we found, what they've seen, and then we walk you through it. This content is actually for everyone. It doesn't matter whether you're a male or a female. If you're a male, your partner, your mom, your sister, your fiance, someone might be having this condition. They don't even know. I have seen people diagnosed only after they got to honeymoon and they thought this time they were going to get pregnant. So stay glued with me. If you've not followed, spend some time, subscribe and follow to this channel. Cheers.